Okay, with that, we start our session, Journal of Population Economics Session I. So we have five very excellent papers this year published in Journal of Population Economics. And the authors are here, and they will present their great work, and then we will open for any discussion questions. Firstly, we welcome Dr. Cigno.
Okay, thank you very much, Mr. Chairman. My point of departure is a much-cited article by Basu and Van showing that under certain conditions, a child labor ban may be self-enforcing. Okay, and this relies on a special assumption, at least in the basic version of the model, namely that above the subsistence level, no amount of present or future consumption can compensate parents for the disutility of child labor. In other words, although they use a different terminology, they have lexicographic preferences above the subsistence level. Below subsistence, it's all hands to the pumps. Everybody works flat out. Okay, and a ban under these assumptions is self-enforcing because it leaves no alternative but the no child labor equilibrium. Now, I show in the paper that the necessary condition for this to happen is that the demand for labor actually, must be sufficiently inelastic for the adult wage rate to jump from below to above the subsistence level. Keep in mind that with lexicographic preferences, there is no utility function, and alternative equilibria are not Pareto rankable because without child labor, profits are lower and parents are happier, but you do not have a number that you can compare with the loss of profits. Okay, the questions I pose is, could the same result or compulsory education be self-enforcing under the more usual assumption that education is an alternative to work and that future consumption can compensate parents for some child labor? And second, given that we can now make comparisons, would the policy be efficient? Okay, now there are three reasons basically in the literature why child labor may be inefficiently high or education inefficiently low. One is the well-known Balan-Robinson problem that children cannot commit to pay back. Young children cannot commit to pay back a loan, and therefore they cannot borrow from anybody. They can only receive parents. And an implication of that is that not only parents cannot lend to their children, but cannot borrow on their children's behalf. Okay. Now, I had demonstrated earlier that under weak conditions, there exists a self-enforcing family rule which obliges adults to look after their children and their elderly parents. Okay, so this if these conditions are satisfied, the problem that parents cannot lend to their children goes away, but the problem that parents cannot borrow on their children's behalf remains, because I cannot go to a bank and say, I have a credit towards my children, can I borrow some money from you and I will pay you back when my parents pay me? I cannot do that because I haven't got a contract that I can show the bank. The second problem is the one identified by Prieto, that education is a risk investments for parents, but not for society, or at least less risky for society, because idiosyncratic risks wash out on aggregate. Okay, you have only, if there are aggregate risks, of course, those go away. But idiosyncratic risks apply only to parents, and therefore risk-averse parents invest less than the social optimum. And finally, there is the ciblage problem that the expected return to education may be low because firms do not invest enough in skill-intensive technology, and they don't invest enough because parents do not invest enough in educating their children. Okay, now in the article I have the usual assumption that the future wage rate is certain for uneducated workers, but it is an expectation increasing in education for educated ones. And there is a fixed school enrollment cost in addition to the opportunity cost of education, such that there will be a threshold current wage rate below which children are not enrolled at school at all. Okay, now if in laissez-faire child labor is inefficiently high or education inefficiently low is the same, then a child labor ban or compulsory education may not reduce inefficiency because it may remove the déciplage problem, but not the Balan-Robinson and Pouliot problems for the reasons I have said. And besides, as if the equilibrium is not self-enforced, if the new equilibrium is, if the policy does not generate a new equilibrium, then there are enforcement costs in addition to the efficiency loss. Okay, and the efficiency loss is reflected in a reduction in the expected social surplus. Now, I argue that there is a first best policy. If we define the efficient education level, that which children would receive if their parents did not face idiosyncratic risks and could pay for this investment on credits, then there is a policy that will take care at the same time of the Balan-Robinson, the Pouliot, and the déciplage problems. And the policy is the following. The government announces in advance that it will borrow from the international credit market sufficiently to cover the cost of giving each child efficient level of education. Use this money to subsidize parents conditionally on their children receiving the efficient level of education, and then recover the money by taxing successful students, tax high skill wages sufficient to pay back the international debt. You see, what this means is that the government does what parents cannot do. Namely, the government can borrow on their children's behalf. Why can it do that? Because it's not subject to the Balan-Robinson problem. The government can impose taxes, and so it can recoup what it's lent to children. Okay, and the policy is efficient and self-enforcing. At least it is under if there is no asymmetric information. If there is asymmetric information, of course, you cannot reach a first best. There is part of the work children do is not observable because it's not carried out in the market, but it is done for their parents. Let's call it domestic work, even though it is not necessarily within the home, but in the family field of family business. And this is private information. It cannot be banned. Okay, and the same applies to schooling. School attendance is observable, but school results depend also on how much time the child spends doing his homework at home and also resting and having a sleep. And since these are private information, the subsidy cannot be made conditional on total time dedicated to education, but only to the observable part, okay? And therefore, the second best policy, which is the same as the one that I have announced, will lower child labor or raise education, but not to the efficient level. And so in conclusion, you have the usual conclusion that one has in optimal taxation exercises, that the policymaker should use all the tools at its disposal, okay, not just one. So it should prohibit or make obligatory what it observes, which in this case is market labor, it can observe, and school attendance. And so it should forbid market labor and make school attendance compulsory, and then use taxes and subsidies to make the prohibition or obligation self-enforcing. Now, the evidence seems to support that. In my references, you find articles which show that if you just make education compulsory up to a certain age or forbid child labor, the results are very disappointing. Basically, they are a waste of time, a waste of money, and may even be counterproductive, may have perverse results. For example, there is an article by Bharadwaji, I think it's called Lakdawala, entitled Perverse Consequences of Well-Intentioned Regulation, Evidence from India's Child Labor Ban. This is in the Journal of European Economic Association 2019. There is an article by Bargain and Boutin, Minimum Age Regulation and Child Labor, New Evidence from Brazil. Another by Pisa and Souza, The Causal Impacts of Child Labor Law in Brazil, Some Preliminary Findings. All of this show that the banning child labor or imposing school attendance has very, very small results, and in some cases actually has the opposite effect. And so that's my conclusion. And these are the essential references I have cited, except the empirical ones that you find in the article. Thank you very much. I think I've stayed within my 15 minutes.
Thank you so much for very insightful presentation. So any questions, comments, insights? We're open to discussion now.
I'm stunned into silence.
Yeah, I may start with asking Dr. Cigno about you mentioned many countries, the market. Is there any child labor market that the government policies address it better than the others? In other words, is there any existing evidence that countries can do the cross-learning and improve and learn from the other countries? Is there any
do what? Sorry, do the cross?
Yeah, I mean, is there any potential for some countries that are doing better in mitigating the child labor market, and other countries may take as a lesson or
I see.
improve?
Yeah, well,
Is there any room for cross-country learning?
I'm an old-fashioned theorist. I'm not the right person to ask that. I just see empirical articles by well-known people showing that if you just use one instrument, the results are disappointing, to say the least, or even counterproductive. Now, if they, I think I would change it. I would change your question slightly. I would say, I would say that's what I'm proposing, which doesn't seem very revolutionary. It's a typical optimal taxation kind of solution. Requires some fine tuning, and there is the usual problem that governments in general and developing countries, governments in particular, may not have the administrative capacity to administer that. That's certainly I'm well aware of that, and I've heard this criticism made many times. But this is not a good reason for undertaking policies that we know in advance are not going to work. You see, going to use vast amounts of money to produce very, very meager results. Okay. Now, if there are virtuous examples to look at, well, I don't know. I'm not the right person to say.
Thank you.
Maybe somebody in the audience knows.
Yes, thank you so much. The beginning of your talk reminded me of this very classical work by Kaushik Basu.
Yes.
Basu taught us development economics when I was at Cornell and PhD program, and I'm very familiar with this article. And I think we were back in more than 10 years ago, during the class, we were discussing about child labor market.
Yes.
And what I'm still wondering is how that differentiate from other markets with stigmatized the stigmatization.
Ah,
Yeah, so I think some of this market are gradually like phased out because of economic development. For example, my dissertation was on plasma cells market, and people have stigma with recognizing that or acknowledging that they sell plasma. But as the living
yes,
standard improve and the economic development, I think some
yeah,
of those market are gone.
yes,
So how
yes,
about the
yes.
child labor market?
Yeah, uh, I think one obvious answer is that we're not talking just of stigma, but we're talking about survival. Right?
Survival, yeah.
I'm talking about
Mhm.
survival. And the
Yeah,
other thing is that a stigmatized markets. One thinks of prostitution, for example.
right.
But here we have two markets which are very closely connected, which is
Mhm.
the adult and the child labor market. So
Right.
the two are very closely connected, and indeed Basu and Van and I and many others assume that you can. Put the two markets together, make one market for adult equivalent labor by assuming that the child labor substitutes for adult labor at a constant rate. Okay, and then in that case, you talk about the market for adult equivalent labor, and so the wage rate that I'm talking about is the adult wage rate. Okay, so this is what differentiates, I think, the labor market, which come in some way be collapsed into a market for adult equivalent labor from other kinds of stigmatized markets,
Mhm.
market for drugs or whatever.
Thank you so much. I don't want to dominate the discussion. Any
No,
further
no,
question?
I'm glad to speak to an
But
ancient student of Kaushik that I know, I've
yeah,
known
this
for a
is
long
so
time.
wonderful work. Yeah, Kaushik and another advisor of mine, Ravi Campbell, they have a book
Uh-huh.
chapter about different kind of stigmatized market, including child labor. I think also
Uh-huh.
including organ sales.
Yes.
Yeah, that's very
Thank you. I
fascinating.
shall look it. I shall look for
Mhm.
something on the
Yeah,
subject.
that's
Okay.
so interesting, important.
But nobody in the audience knows of virtuous examples of countries that are so sophisticated that have governments so sophisticated that they can embark in the credit-backed
Mm.
policy that I suggest.
Yeah. That reminded me another policy called a conditional cash transfer. So that's a policy in many countries that conditional sending kids to school, right?
Yes, yes,
So,
yes. But they have got very little effect. You see, this is
oh, I see.
just giving the money without
Yeah,
the rest
I see.
is not good enough. This is the
I
point.
see.
You need to use everything
Right,
that you can. So anything that you can see, that you can observe, you fix directly. You fix anything that you cannot fix, well, you use
right.
distortionary taxes and subsidies. This is a general principle. I've just applied something very general. And yeah, okay.
Thank you.
Yeah, we're running out of time. So,
Yeah. So let's move to the second speaker.
Sandro, yeah, you have to move out your
Yes, I have to
Okay.
presentation.
go. Okay.
Yeah, that's right on 20 minutes. Now let's move to the second speaker.
Thank you very much.
Thank you so much for the wonderful presentation. The second speaker will be Dr. Jiao Yang.
So can everyone see my screen?
Not yet.
How
We
about
see
now?
your folder.
A folder?
Not the
Yes.
presentation yet. Yeah.
Yeah, perhaps you have two screens.
I guess so. Let me
Oh, yeah.
try. No, it's not. That's not mine. This is.
Uh,
I did sharing,
yes,
but
now. Yeah, we just saw the slides, but now back to the,
did you see it? How
yes,
about
now
now?
we see it. Oh,
Okay. Yeah.
Could you make it a full screen? Okay, now.
How about
Yeah, we
now?
can
Yeah.
see the full
It looked
screen.
better.
Yeah, the floor
Okay.
is yours. Yes.
All right,
Please.
thank you, Dr. Chen, and thank you for including our paper in the session. And special thank you to Chiara for willingness to switch in with me to accommodate my teaching schedule. I have to run a bit earlier because I'm teaching this in 1 hour. So I will do my best and to complete in 15 minutes. So this is joint work with Chris Xiaolong and Adam Chen and Lei. So Xiaolong is also in the room. So if you do have any questions, feel free to either type a comments or just anything, just give us any feedbacks. So we are looking at the lasting impact of Tuskegee study and by analyzing the COVID vaccination hesitancy among African Americans. So African Americans were disproportionately affected in terms of economic and health outcomes by COVID-19. Compared to the non-Hispanic whites, they are 3 times more likely to get COVID-19 and up to 6 times more likely to die from it. And given its critical role in reducing fatality and severe diseases, so a lot of concern about what is the vaccination uptake among racial and ethnic minority groups. And on top of this lower vaccination rates, there are several barriers African Americans face. That's when it gets to the healthcare service, because they normally have a limited income, so they tend to have a lower or limited insurance coverage, and they tend to live in the suburban and rural areas in the U.S., which facing a shortage of the healthcare service, and they may suffer from the transportation issues, may limit their access to getting treated. So there are also some systematic and cultural barriers, including implicit bias from physicians, and the gaps in providers' diversities and communication barriers is also contributing to their limited use of the healthcare. And one of the reasons pointing out is the historical distrust among African Americans, so which leads to several negative impacts, including reduced use of public service health service, and their lower participation in clinical trials and increased refusal of vaccination. But before we get to the study, we didn't find any prior research by looking at how is the COVID-19 vaccine uptake and related to the Tuskegee study. And even though the study has been widely cited, so in the African Americans' low trust in Medicare. So give a brief background about this Tuskegee study, especially for those who is not based in the U.S. And in 1932, the U.S. Public Health Service, that's in collaboration with Tuskegee Institute, launched a study documents the natural progression of untreated syphilis. They initially named as Tuskegee Study of Untreated Syphilis in Negro Male. They recruit 600 Black men, 2/3 of them with the syphilis disease, and 1/3 do not have the disease. So even 10 years later, penicillin was widely used to treat for the syphilis. All those participants were denied for getting treated, and moreover, they are discouraged from seeking outside care. 40 years later, this study ended because of Peter Buxton whistleblower exposed it to the New York Times, which the revelation of this Tuskegee study leads to a public outrage, and eventually led by a National Association of Advancement of Colored People's lawsuit against the USPHS. And even though it's been a lawsuit and a lot of compensation, the harms to those participants and their families has been made and has not been reversible. So we get our data from 3 primary resources. The vaccination coverage, that is the weekly data recorded by CDC COVID-19 vaccination tracker. That is based at the county level. They track their vaccination rates, and they ask people reported their gender and their race. And also we constructed the racial composition and the county level variables based on 2010 census, and get some other demographic and socioeconomics data from the American Community Survey 5-year estimates. And in the last one to testing our the mechanism, we retrieved the vaccination hesitancy data from the household pulse survey data was conducted by the U.S. Census Bureau. One of the main variables we're interested to capture is whether and to what extent the Tuskegee has differential impact on people of different color and white stat. So inspired by the work of Alessandro and Wanamaker, who they're studying what is the long-term effect, long-term healthy impact of Tuskegee on Black African American men. So based on the studies that which constructed this geographic distance based on individuals' residence to the Macon County, Alabama. And their argument is very simple. The proximity, including geographic distance and the similarities of two individuals' socioeconomic status and their demographic attributes, influence their perception when the Tuskegee effect actually blows up, and how it affects people's perceived local medical system. In this context, individuals near Tuskegee, because they feel more related and they're more likely to be informed about this event. Bear with me because we've been testing this exposure with different alternative measure, and we're going to talk about that in the robustness checks. And this is one of the way we're testing. We measure individuals' geographic distance based on their residence to the Macon County. And in this way, we can actually say, hey, for those people who live closer, they'll be more informed. As a result, they have a higher mistrust of the medical system and leads to their lower vaccination uptake. And not only for that, we take one step further. We're saying, hey, this exposure may be going to have this differential effect on people with different color. So for those who is being more related, have the same colors, such as Black people, they feel more related. As a result, the exposure to the events will be stronger. So we are testing the estimates by including the interaction term in this regression. The first term and the PB percent the fraction of Black population in County C, and interact with the distance and to the Tuskegee Macon County, and interact with the weekly dummies, and to capture how the differential exposure to Tuskegee study varies with the percentage of Black people over time. And the outcome variables is the vaccination rate at County C at time at each week. And for the control variable, we include the fraction of people in other race, fraction of white, fraction of people of non-Hispanic white, and fraction of Asians, and the fraction of people who completed high school and some local economy indicators such as unemployment rate. And we also control for the fixed effect, several fixed effect, county fixed effect, and the weekly fixed effect. What is the other results look like? So based on this result, based on this table, everything in this blue shaded areas shows the gap between the different percentage of Blacks, counties with different percentage of Black people. So this is showing that relative to the county with the lower Black population, and for county with a higher share of Black population, it tends to have a lower vaccination rate. The gap is very consistent. But this gap will be mitigated by the exposure to Tuskegee study. And as you see that on this highlighted on the red areas, on the red rows. So this is showing that for those who feels a little bit less exposure, longer distance to Tuskegee study, the gap is started to close. And we run several specifications by including county month fixed effect and a county weekly linear trends, and it's also the results are robust. So guess two, what explains our results? The mechanism, what explains that? So there's several reasons. I guess everyone cannot see that's on the top. So I'm showing that there is a flow chart, exposure to Tuskegee, how is it going to influence the vaccination take-up rate. Can be through in two primary channels. The first one is the theory of social identity. And it's essentially saying that individuals respond more strongly to injustice affecting their own groups. By their own groups, which can be defining as in closer proximity to them, as very similar determination as we have determined exposure to Tuskegee, saying either by defining as their same color, skin colors, and the same race and same ethnicity. So this is saying for those people, Black people, they feel more related when this revolution of Tuskegee's blow out through social media. So they'll feel stronger being unfairly treated. And as a result, the revelation heightens their mistrust among African Americans, especially for those living closer to Tuskegee. How do we test it? We're going to use the data. We use the data from the household pulse survey data, and we take one question from this. There's one question asked about once the vaccine is was available to you, will you be willing to get the vaccine? So there are 5 questions, 5 answers are recorded. So people are going to define the definitely get a vaccine, probably get a vaccine, unsure, probably not, and definitely not. Based on those responses, we constructed our measurements saying the strongly hesitant, including definitely not, and hesitant, including definitely not get a vaccine and probably not get a vaccine. And before showing the results, we do a very rough comparison by looking at the share of Black population and the vaccination hesitancy rates in the US over the map. So you see that, hey, this is a kind of positive correlation for a county with a higher share of Black population that tends to have a higher vaccination rates against getting vaccinated. So, and the results support that. For those people, for those countries have a higher Black population, their vaccination hesitancy is going to be higher, it's going to be stronger. But it's going to mitigate it by the exposure to the Tuskegee study, because the longer distance we see that, then there's actually the negative impact on reducing this vaccination hesitancy. And there's another possibility we have to rule out. Maybe some counties, especially for the counties with a higher Black population, they tend to have a limited or lower vaccine supply, and the medical physician supply tends to be in a shortage, and access to the vaccine for the African Americans will be limited. So in doing so, we control the number of medical doctors in a county and the number of pharmacy sites for counties. Both are normalized by the county's population in the regression, and the results still robust. We did several robustness checks. So far, we cannot say that we find a causal impact. So we done, in addition to this 4, we done 16 overall. So in this one is showing that we run this by looking at the exposure to Tuskegee on other races. We didn't find any impact on the non-Hispanic whites, Hispanics, and Asian Americans. So in that, this Tuskegee, in fact, only influenced the vaccination uptake rates for the African Americans, which is the most close related groups to the participants of the Tuskegee study. And we also use alternate measure of the Tuskegee exposure. Instead of looking at how the geographic distance between their residents and the Macon counties, we use the circulation of the news. So based on the circulation of the Tuskegee news between 1972 and 73, we constructed index to saying that maybe some counties, they're going to be sending out more news, and people in that county, if they received a lot of information from the news about the Tuskegee, they have a higher exposure. And our results still robust in this alternative measure. And we also perform a falsification test by replacing the Tuskegee by the Tulsa massacre. You know, both Tulsa massacre and the Tuskegee are targeted for Black people. And Tulsa massacre is mainly targeted for their financial assets. So after replacing the Tuskegee impact by the Tulsa impact, we find no impact on Tulsa on vaccination take-up, and providing some evidence saying, hey, this is actually the Tuskegee impact on reducing or on influencing people's vaccination behavior. And since our construction for the Black population is based on 2010 census, there's some kind of concern about whether there's a migration can be biased the population geographic composition for a county. So we replaced this 2010 census by either 2005, and along with other census, and the results still remain. So that gets to the conclusion. Our study shows that vaccination rates increase more slowly in counties with a higher proportion of African American, despite the gap closes over time. And the county close to Tuskegee see the gap close even slower, suggesting more distrust due to increased exposure to the Tuskegee study. And the COVID-19 vaccine hesitance is higher in areas with a larger percentage of Black residents. That concludes my presentation. Am I on time?
Yes,
Okay.
we're on time. So yeah, now we open the floor for discussion, questions.
Well, maybe I have one. Can
Yeah,
I
please.
ask?
Sure.
So I was just curious because about your measure geographical distance. So in terms of, so you say the gap is closing with distance from the study. Did you explore, just out of curiosity, some non-linearity, like is the effect very strong close to the study and much less farther away? Because, I mean, unfortunately, the study took place in Alabama, which is also a place where other things happened with respect to African American populations, the African American minority. So I was wondering whether the effect vanishes if you go to New York, or there is still because what you show is like a linear impact. So I was wondering whether you have some idea about non-linear potential, non-linear effects.
Yes, thanks for the comments.
Sorry to interrupt here. Can you close your screen?
I'm sorry.
Because we have now twice the session on. Okay, thank you.
Okay. Yeah. Yes, I think that's a very good comment. And we didn't actually test for the non-linearity in the geographic distance. But what we did is actually we did some the permutation test by replacing the distance for county's residency to Macon County to any central node of any states and counties. And we didn't see any other counties and states, such as the distance to any other county or states other than Macon County stands out.
Mm-hmm.
I think that's a good one. We should maybe try the square term or quadratic terms of this geographic distance. Maybe they show some kind of curves. Yeah.
Dr. Jiao, thank you very much for the great work. And yeah, I was glad to handle this paper. I was fascinated by the findings. And I work on something about structural racism. So that remind me of something were you also considering about, because you were measuring the share of Black Americans in the county, right, in the district.
Mm-hmm.
So that may also relates to the school racial segregation in their young childhood or adulthood, and how that's combined with those vaccine effect to have a long term. So were you able to consider at least controlling for some of those? I know that was very early years. The data could be an issue.
Yes, actually we did. I forgot to include that. That's very good comments. we did the residential segregation. We took the top percentile of mostly segregated counties versus the least segregated counties and compared the coefficients. We didn't see the coefficients is significantly different from each other, saying that the segregation maybe not be an issue. So I think that's kind of the same as the controlling for the residential segregation in the regression.
Mm-hmm. Thank you. Yeah, any further questions? So overall, I think this work actually becoming more and more relevant since you know that the president-elect Donald Trump was nominating Robert F. Kennedy Jr. as the HHS commissioner, and yeah, he has a strong doubt about vaccine. So I think let's see, with time goes on, this paper may be very important to shift people's idea of how to educate people about the value of vaccines in this new era.
And we also think part of the reason for the implication of the study is saying when we implement any of the vaccination policy, not only we need to consider for the effectiveness, also cultural impact, such as the mistrust among the different groups, which going to affect the effectiveness as well.
Right. Thank you. Yeah, with that, we are running out of time. So let's welcome thank you so much, Dr. Jiao. And let's welcome the third speaker, Lukas Delgado.
Okay, hello to everyone. Nice to meet you virtually.
The floor is yours. Please try your space.
Thank you, Chi. So let me just share my screen now. Very quickly, I hope everything is working. You see it? Yep, you're seeing the presentation?
Yes.
Yes.
Okay, perfect. So my name is Lukas Delgado Prieto. I work at the University of Oslo as a postdoctoral fellow. I'm very happy to speak about my published paper in Journal of Population Economics, titled Immigration, Wages and Employment, and the Informal Labor Markets. So what's the motivation for this project? We have seen in the last decade that several countries have experienced significant population outflows. You can name some countries like Afghanistan, Ukraine, Syria, and Venezuela, among others. And the interesting thing about that is that most of these outflows can generate some impacts on the receiving populations. Another interesting fact about these population outflows is that most of these, what we call immigrants or refugees, are going to nearby developing countries. And in developing countries, labor markets have different characteristics compared to developed economies. For instance, the formal labor market is large, with all their other characteristics of this type of labor markets, like the lack of minimum wages or the flexibility to adjust to what we call like an immigration-induced labor supply shock. Given that this is a global phenomenon that is increasing the size of the immigrant populations in these kind of countries, studying what are the impacts of this immigration on the labor market outcomes of natives in this kind of context becomes a relevant question. And in particular, I'm going to focus on a specific event in Colombia. So in a nutshell, what is this paper about? So I will show that the arrival of immigrants will create an asymmetric wage and employment response across the formal and informal sector. So depending where the native is working might have a very different impact in terms of their wages and employment. And I'm going to explain why this happens. The episode of immigration that I will use is the recent Venezuelan mass migration to Colombia. In the last decade, you have seen the news, but more than 1/5 of the entire population of Venezuela has moved to different Latin American countries, with Colombia as the main receiver. And to analyze what is the impact, I will use the Colombian Labor Force Survey that measures the labor income and employment of the two types of workers. And this is kind of something nice of the setting, which can measure accurately these two types of sectors that in some countries, they do not have such reliable information. And the strategy to analyze the impact, I will use regional wage and employment regressions across both sectors. And then with these results, I will try to build a simple theoretical model to explain or rationalize why we could see these asymmetric responses. Hey, briefly, what's the Venezuelan mass migration and what it's like drivers? First of all, Colombia and Venezuela share more than 2,000 kilometers of terrestrial border, and due to the initial, like, let's say, past century conditions of Colombia, many of them just flee to Venezuela due to internal conflict, and also because the economic conditions were not good. And on top of that, Venezuela during the 1950s and 1960s find one of the largest oil reserves in the world, which generated more pull factors for Colombians to go there. But then the last decade was a recent reversal due to Venezuela's socioeconomic and political collapse that triggered massive exodus of individuals, as I just mentioned before. And not only Colombia has been received many of these immigrants, but it has been implementing different type of labor market policies to integrate them. So for instance, since 2018, almost all undocumented Venezuelans, given just some specific conditions, they are able to get work permits like PEP or PPT by its acronym in Spanish. And also bear in mind that they speak the same language and sometimes share a similar language than Colombians. So this means about the kind of integration that they could have in the Colombian society. But even with these policies that help to integrate them, the vast majority of them finish working up in the informal sector. Okay, so let me show you some descriptive facts so you can take that before I show the results. So in panel A, I'm showing the share of informality for the two types of workers I'm going to analyze. So first, Venezuelan immigrants, you see that most of them, or around 90% of them in 2018 and 2019 work in the informal sector, while for natives it's around 50%, but still the share is substantial. This is one characteristic that is important of this kind of middle income country labor market relative to others, that the informal sector is substantial. And then what's the key characteristic of the informal labor market? In panel B, I show the wage density by these two sectors, and the red dashed line shows that informal workers not only earn lower wages on average, but this concentration of the blue line in here, it refers to the minimum wage. So these informal workers are not subject to a binding minimum wage, although they could be earning it. So this says that probably the flexibility they can adjust, like the flexibility to labor supply shocks might be different, because formal workers will have a wage floor, which would be the minimum wage. And this creates some distortions in the labor market that I will also try to rationalize with the results. So this was like explain a bit the context, because some of you might not know how the Colombian labor market works. And then in terms of the shocks, I'm going to show you two quick facts. And first is the gradual shock of the immigration from 2015. So from 2013, many Venezuelans started going to Colombia, but from 2016, it really jumped. So you can see in here how the scale of the shocks, that in 2019, almost 4% of the working age population was a Venezuelan immigrant in Colombia. And then the kind of identifying variation that I will exploit in my analysis is that in some areas, there were more immigrants relative to the local population than in others. So I'm going to compare the areas that receive more immigrants to the area that receive less immigrants, what is called like the spatial approach. And then this kind of diff in diff design where I'm exploiting a spatial exposure with time differences before and after 2015 to measure the relative effect of the arrival of immigrants in terms of wage and employment for natives. So this, what I just stated in words is I can show the equation that does it, and it's like, as I mentioned, is a dynamic diff and diff or an event study equation where I have regional outcomes that are at the department level, which is the subscript D, and then I have the T for time, and in this regression, my coefficient of interest will be this beta t, which measure the relative effect of the immigration share at the D level, which is this MD. And then it's interacted with the time dummies because I want to measure the impact relative to a baseline year or an omitted category, which is 2015. But again, also testing for any effect in the years prior to the arrival for this idea of let's make a classification test or a placebo test on pre-trends to see how these two types of areas were evolving, areas more affected by immigrants or areas less affected. This shock, it's a measure. It's a measure with the census to alleviate these concerns of attenuation of measuring immigrants with service. And then, of course, there are other issues besides the pre-trends, and is that the arrival of immigrants into a certain area is not random. There's some endogenous sorting. So I try to deal with the endogeneity by using two standard instruments, which are the distance to Venezuela, which you can see in here, that this is Venezuela and Colombia. There is a predictor. As you're closer to the border, you're more likely to receive immigrants. And also I use the standard past settlements or historical enclaves of foreigners to predict the arrival of more immigrants. This is the two instruments I use. And then broadly, this is my first main result. And is when I divide the impact on natives, I'm focusing only on natives, in terms of their hourly wages and in terms of their employment, which is the panel A and panel B. So in here, before 2015, it shows if there is any differential trend between areas that receive more immigrants and areas that receive less immigrants prior to immigrant arrivals, which is a suggestive test of the parallel trends assumption needed to identify this beta t parameter consistently. You can see in here that for wages, it tends to be hover around 0, so there is not much difference. And I plot in here both the OLS and the IV with the two type of instrument results. And for the post-treatment periods, you see how after the arrival of immigrants, there is an important or a kind of large decrease in their average native wages. This is in relative terms. So it's around 1.6 to 1.7%, the drop in the growth of wages, comparing areas with more immigrants and less immigrants. And this also is followed by a drop in employment, which tends more time to be realized, but it's also big. It's around 1%. Okay, so once we have this general impact, this could mask some heterogeneous responses, because as I told you, this shock was absorbed mainly in the informal sector. So what happened when we analyze native workers by their, if they are formal or informal? So in here, I have the same two outcomes, hourly wages and employment, but now I'm dividing by their sector they work. So in terms of wages, you see that most of the negative wage that I just showed to you is driven by informal workers. And this is expected in the sense that most of immigrants are working in this sector. So there is an increase in the labor supply in this sector. And then, of course, because there are no any restrictions to their wages, so wages can adjust flexibly, they adjust downwardly. Then in terms of employment, the result is kind of the opposite. So it's not driven mainly by informal workers, but formal ones. So how to rationalize this? And in Colombia, the context is that these two sectors are not entirely independent. So there are some firms in the economy which can hire both types of workers in the same firm. So they can hire some workers formally and some workers informally. And as the cost of hiring workers informally is now lower due to arrival of immigrants, there are some firms that are displacing or changing their formal workers for the now cheaper informal ones. And I show in the paper that this is mainly happening for minimum wage workers. So those workers earning the minimum wage, which are on the margin of informality, are the more likely to be displaced by informal workers, as their task can be done also by an informal worker, because you could argue that they have similar skills, as minimum wage workers tend to be the low skilled workers. In fact, if I even zoom in a bit more in terms of the subgroups of workers more affected by the formal and informal sector, you can see that in terms of employment, the highest coefficient is given by low-skilled workers, while in terms of wages, most of them are zero, again, consistent with the hypothesis that there is a minimum wage that limits any kind of downward adjustment. And in terms of informal wages, which was also the one driving the total wage impacts, again, low-skilled workers seems to be the most affected. Okay, so then to conclude, in this paper, I'm comparing regions in Colombia with varying immigration exposure, and I document that this reduction in informal wages or informal labor income that we see in the informal sector can lead to a decrease in employment in the formal sector. So there's an asymmetry in the type of responses we see. And this is something not unique to Colombia, but it's something that can be interesting to other contexts. And in the paper, I also try to, I didn't have time, and we can discuss it further if there are some questions. I construct a model that can rationalize that some firms can substitute formal for informal workers, but only when there is a high substitutability in them in production. So in words, it means that whenever an informal worker can do the same task as a formal worker in production for the firm, then whenever there is a drop in the cost of informal workers, the firms will just try to re-optimize their labor force and hire more informal workers. So as I was mentioning, the motivation, this is not only a Colombia-specific results, because there has been other contexts that has been receiving this type of immigrant inflows. And one thing that can be, let's say, generalized to other contexts is that the combination of how large is the informal sector and then how binding is the minimum wage for some formal workers can determine these responses across the informal and formal sector in other contexts. And one thing about Colombia that makes this minimum wage so binding is that the minimum to the median ratio in Colombia is the highest of all OECD countries, which highlights that this distinction between the formal and informal sector with the minimum wage is even more important in this context, but also like countries like in Turkey, it is high. So there could be some let's say some factor of the minimum wage that could make these responses asymmetric. So thank you all for hearing, and I'll be happy to answer any questions if you have. I think I passed my time.
Thank you so much. Now is the time for questions, comments, insights.
Can I ask a question?
Yeah, sure, please.
Yeah.
Thanks, Lukas. Great presentation. So I was just curious about the sort of the makeup of the workers immigrating from Venezuela. So was this mostly like low wage, low skill workers that were immigrating, or did you see a significant amount of sort of higher skill immigration as well?
Yeah, that's a good question that I didn't show any descriptives about that, but what we can see from the labor force survey is that they are workers that on the majority they are low skilled, but if you compare with the average education characteristics of natives, they are similar. So you can kind of argue that there could be some substitutability in terms of between immigrants and natives. But then if you like zoom out to other countries, there you see that the ones that go to Colombia tend to be the lowest skills relative to other countries, like you can think of Spain, US, Argentina. So there's some selection in the ones that go to Colombia, but even with this negative selection, in some sense, they tend to have similar levels of education to natives, which helps to answer this kind of the question of they are substitutes or complements to the native population.
Yeah, makes sense. Thanks.
But yeah, it's a good question.
Any other questions? Yeah, I have a brief question. So that this article actually become very relevant to the U.S. immigration policy as well nowadays, and people are like arguing that immigrants may affect some industries more than the others, like the real estate, building a house or other things. So were you able to also look at by different sector? Now you are looking at the informal and the formal, but is there any other ways to look at the refined level?
Yes. I think that's the industry level is very interesting because, for instance, in the Colombian case, you see that most of immigrants end up working in the service sector. But the service sector in Colombia is very different to the US one because the service sector in Colombia is mostly restaurants, hotels, and kind of low skill occupations in some way. And in the paper, I do show that most of the impacts within these two test sectors are concentrated in the industry of commerce, hotels, and restaurants. But yeah, in the US, then again, you have a different type of what I like. I am also working on different other projects about immigration. What it's my take about this, about how to try to understand what could be the impact of immigration is you have to take different things into account. First is like the characteristics of the receiving labor market. Also, you have to take into account the characteristics of the immigrants that are going to that country, and then what are the characteristics of the natives in that country. So it's a bit of the institutional context, but also the type of immigrants that are entering there. And then with that, you could make some predictions of who might be more or less affected. But again, this is short-term effect of the impact of immigration. There's literature showing that in the long term, probably there could be some firm creation, innovation, and other things might be going on. But in the short term, this is what we see in Colombia.
Right. Thank you so much, Lukas. And I see no other questions. Is there any? Okay. So with the time now, we're running out of time for this presentation. Thank you so much for the wonderful presentation, Lukas. And then now let's move to the next speaker, Ben Cowan. So the floor is yours. Thank you. Let me try the slides.
Okay.
Yes, it works.
Does that look okay?
Yes.
Great. Okay. Thanks, everyone. So this paper, Time Use, College Attainment, and the Working from Home Revolution, is what I'm going to be presenting today. This is a figure that comes from this paper by Barrero, Bloom, and Davis, which shows the huge increase in work from home in the United States. And this, of course, has been similar in many other countries. But roughly speaking, work from home rates are about 4 times what they were prior to the pandemic, even though they're much lower than what they were of course, during the very height of the pandemic. But this appears to be a phenomenon that is here to stay to some extent. And I'm going to be focusing on that in my paper. So other work has shown that many workers have a preference for remote or hybrid work. And, broadly speaking, I'm interested in how working from home sort of affects other aspects of workers' lives. And the question in this paper is, how has the WFH revolution induced by the COVID-19 pandemic affected time use of workers? So there are a couple of different channels by which WFH might affect time use. The most obvious is that when you are not going into the office or to your workplace, then you save time by not commuting, and that's a fairly big deal. So the average American commute to and from work was almost an hour in 2019. But there are other channels too. So there could be flexibilities introduced when you're able to work from home, where you're able to mix and match activities that are work and not work throughout a day in a way that you wouldn't be able to when you are working at a work site. Okay, so here's a methodological issue, which is that identifying how work from home affects time use requires exogenous variation at work from home. I am going to do something somewhat different in this paper, given that I don't have a great instrument for work from home. I'm going to examine trends in time use by college attainment. So unlike work from home, college attainment rates did not change suddenly among working age adults immediately after COVID. However, college graduates are much more likely to be in teleworkable jobs or jobs that lend themselves to working from home, typically work on a computer, compared with non-college graduates. So what I can identify is how COVID changed time use for college graduates relative to non-graduates. Now that means I can't ascribe those changes to changes in work from home among those two groups per se, but my findings suggest that work from home does play a major role in ways that I hope will become clear. Now, why might we be interested in differences in time use by college attainment? So disparities in health and other forms of human capital by college attainment are large in the US, and they've actually grown in many ways in recent decades. And since time is an important input to own and children's health and well-being, the work from home revolution may have affected disparities by college attainment. And my results are gonna speak to that. So the data I use in this paper is from the American Time Use Survey. That's a 24-hour time diary that is taken by a subset of the current population survey respondents. So I use 2015 through 19 as the pre-pandemic period, and then August 2021 through December 2022, which was the data that was available at the time that I did the results for the post-COVID period. And that's because by July 2021, all state level restrictions on business activity and group gatherings had been lifted. And of course, the vaccine was fairly widely available at that point. So I'm going to divide time use into 10 mutually exclusive and comprehensive categories. And then also within those, examine some specific activities that are arguably most likely to be affected by work from home. So here are the comprehensive large time use categories. Yeah, I don't think there's too much to say here. Travel here is something that can be confusing. You should think of this as any time that you spend getting from point A to point B, right? So that it's travel in that sense. And then the specific activities I'm going to look at are, number one, work that is performed specifically from home. So you do get the location of an individual's activity. And so we can look specifically at work from home. Commuting time, which is travel specifically related to one's job, eating at home versus eating away from home. And then something I'm going to focus on a lot is time spent with children, time spent actively engaging with children. And then what's called secondary childcare, where you're sort of monitoring children, but your primary activity is something else. Okay, so again, with regard to identification, I don't have an instrument for work from home, so I cannot analyze the causal impact of work from home on other activities. But what I can identify is the relative change in time use for college grads from before to after the pandemic. And that relative is with respect to non-grads, of course. Now, that in and of itself may be difficult to identify as an effect of COVID if trends for grads and non-grads would have been different even in the absence of the pandemic. So to examine that possibility, I look at event study plots for key variables by college attainment. So these are really simple event study, this specification is a simple event study specification where I'm looking at the year effects for college grads and non-grads separately. And with Y is a work from home related outcome. And then I include several different controls related to time, demographics, industry and occupation, and things of that nature. And what you see when you look at that is that there is very little going on. If you look, for example, at daily time spent working from home, so this is just total minutes that an individual worked from home, you can see that there's very little going on in the pre-pandemic period. Then once we get into the post-pandemic period, you see a large jump that is somewhat mitigated in 2022, but still large and significant for college graduates. And then you still do see a positive effect on non-graduates, some of whom can perform their job from home and transitions to work from home, but it is much smaller than what you see for college grads. Interestingly, time spent working, just total time spent working, doesn't really seem to change from before to after the pandemic. You see a similar thing with daily share of work time from home. So this is for individuals who logged any work activity during a day. A similar picture to what you see just for total time spent working from home. And then you also see the reduction in travel, principally related to commuting, that occurs as a result of the large increase in work from home for college graduates. Okay, so the summary here is that changes in work from home relative to 2015 only occurred after COVID. And the lion's share of that increase has been among college graduates, right? So the share of work done from home increased by about 22 percentage points for college grads and only 7 percentage points for non-grads. So with that in mind, I'm going to employ sort of a standard difference in difference specification to examine changes in time use for college graduates relative to non-graduates from the pre-pandemic period to the post period. And that is this fairly standard specification that I have here, where I'm looking at the interaction of college graduate with the post-pandemic period, and why the outcome here is minutes spent per day in some particular time category. Okay, just in case you're interested whether the sort of employment, income, or occupational outcomes change for college graduates relative to non-graduates from before to after the pandemic, my results here, or the data suggest that that really isn't the case, right? So there isn't much effect on employment, income, or whether a worker is in a quote unquote teleworkable occupation, or that doesn't change for college graduates relative to non-graduates. Now the time use results. So first, with respect to time spent working from home and highly related outcomes, you can see that the increase for college graduates relative to non-graduates in the post-pandemic period is about an hour per day on weekdays. There's very little effect on weekends, as you might expect. And this is large relative to the pre-COVID mean for college graduates. You can also see this reduction in commuting time and then total travel time that kind of go along with this increase in work from home. Okay, now in terms of other ways that people use their time, or sort of my more general time categories, there is little effect on exercise and sleep, and little effect on total time spent eating and drinking. We do see some evidence of substitution from eating and drinking away from home to eating and drinking at home, which is not surprising. When people are working from home, they will often eat at home as well. Okay, now turning to some other kinds of activities, we see some reduction in self-care. I don't know if that is time that you save not having to dress for work or that kind of thing when you're working from home, but we do see a reduction there. And an increase in free time, as I define it, that is associated with for college graduates relative to non-graduates, again, in the post-pandemic period. And then you see some effect here or some evidence of an effect on caring for household children. But of course, this is for everyone. And so one thing that I want to do is zero in on those who have household children or children in the household. And so that is what I show you in the next slide. So in the top panel here, we have individuals with household children, and what you see is much larger effects for them. So total time spent caring for others increases by about 20 minutes, and essentially all of that is with respect to caring for household children. There's also a marginally significant increase in secondary childcare associated with being a college graduate, again, relative to non-graduates. Okay, so all of these results seem to be fairly consistent with the idea that working from home is driving what's going on with these changes in time use, although, of course, I cannot say that for sure given my identification strategy. Okay, so lastly, I'd just like to mention a few results with respect to gender. So women in the sample are less likely to work at all in the US, where they work fewer hours in general. And going along with that, they're actually more likely to hold jobs in which telework is possible, in which working from home is possible. So I run the baseline regression for men and women separately because of these differences. And actually, what you see when you do that is that, if anything, the increase in time spent working from home for men is a little bit larger. And what you see with respect to caring for household children is that it's really concentrated among men, even though secondary childcare is pretty similar across the two genders. But for men, we see this significant increase in time spent caring for household children that goes along with their somewhat larger increase in time spent working from home. And notice that this is interesting given that pre-COVID, this amount of time spent caring for household children on an average day is less than half for men what it is for women. So this has the effect of closing the gap for college graduates in terms of how much time is spent with household children for each gender. So to summarize those results in a little bit more formal way, the effect of COVID on work from home is a bit larger for college men than college women. That may be due to the fact that a good share of non-college women are actually in jobs with full telework potential. And then it is only men who see an increase in active caring for children. And that effect is about 40% of the pre-pandemic difference in that variable across gender. Okay, so in conclusion, the change in working from home due to COVID has really been concentrated among college graduates. We can say that for sure. And on average, college grads save about 22 minutes per weekday in the post-pandemic period through reduced travel and self-care time. Part of that appears to be reallocated to active time with children, especially for men, as I've just shown. And since time is such an important input to children's human capital development, the working from home revolution appears to have the potential to increase gaps by parental educational attainment, because parents with college degrees are now able to spend even more time with their children, sort of exacerbating that difference between what they typically do and what people without college degrees did in the pre-pandemic period. So that's everything. Thank you.
Thank you very much, Ben. Any questions?
I have a quick question about the composition of the sample, because I understand that you're following employed workers during in the survey. So I was thinking, have you checked the composition of employment between college and non-college grads that could change in response to the COVID pandemic? And then therefore there's the comparison between after and before the pandemic might reflect also compositional changes in the employed population.
Yeah. So let me make sure I understand your question. Are you wondering about whether employment changed differentially for college graduates relative to non-graduates from before to after the pandemic? Yeah, excellent question. And the answer is actually no, both in terms of whether someone is employed and total time spent working. There isn't a differential change for college graduates relative to non-grads.
So the gap between them remain the same before and after. Okay.
Exactly.
Yeah.
Yep.
Any other questions? Thank you, Lukas. Yeah, I have a quick question about whether you look at the time spent with friends, because I'm trying to think about the welfare implications about work from home. Time spent with friends might be an indicator. Like people spend more time, can be happier and enhance their well-being.
Yeah, this is a great question because I think that there's a lot of there's some worry about working from home isolating people, from colleagues at work and that kind of thing. That's not something I dug into in this paper, but it's definitely an interesting extension. I did show that free time increases for college graduates relative to non-graduates, and that would include social time, right? So time spent with friends, as you just said. So that would be a subcategory that I think would certainly be interesting to dig into. Yeah.
Thank you so much. I see no hands rising. So in the interest of time, so let's move to the next speaker. Thank you so much, Ben. Wonderful talk. And the last but not least speaker, Dr. Canta. Please, yeah.
I just share my screen and I don't know why
And we still have some time after Dr. Canta's presentation if you have additional questions for previous speakers.
Okay. Can you see my slides?
Yes.
Okay. And I gather you can hear me, so I can start. Yeah. So thank you very much for being here until the end. And I'm very happy to have the opportunity to present this paper, which is, so my name is Chiara Canta. I am at Toulouse Business School, and this is a co-author paper with Marie-Louise Leroux, who is at the Université de Québec à Montréal. So this is a theoretical paper about financial education. So it is a theoretical normative paper. So we started, the starting point of this paper is that we basically know that the acquisition of financial education and of financial knowledge has become very crucial recently because, well, it is the last bullet point, but probably it is the starting point of our paper. There's been a shift in the pensions, in many pension systems, from defined benefits to defined contribution pension plans, and so more and more responsibility has been put on individuals when it comes to their lifetime financial planning and decisions. And mechanically, also there have been demographic changes that have made these decisions more important because of increased longevity. There is also an increased retirement period, which is expected for us. And also financial products have become more and more complex and more numerous. And so with respect to a few generations ago, people have to make more and more complex decisions concerning in particular their pensions. And there is quite a lot of evidence. I'm not going to talk about the single papers, but there is a lot of evidence showing that financial education is very crucial when it comes to these decisions. So, for instance, it has been shown that financial literacy is correlated with the stock market participation, and also financial literacy is positively correlated to retirement preparation, which is measured, for instance, by asking people whether they are thinking about their retirement. And so all in all, the literature points to the fact that people don't necessarily have all the information when they have to make their financial decisions. And financial education, probably you should write education, can correct at least partially for individual biases and misperceptions and costs related to access to different financial products. And here in this paper, we will consider two instruments that the government might have to help people make that decisions. One is the traditional one, having public pensions like compulsory contributions, and the second one is financial education. When we talk here about financial education, we are thinking about, we're quite agnostic about the type of education. We are very general. You might think about programs that are implemented in school, like in high school, part of the curriculum. You might think about provision of information. For instance, in many countries, well, it depends on the regulation, but when you want to access certain financial products, you need to get some information and counseling. And it can be just programs that are implemented outside school, and so on and so forth. So we have in mind that when we talk about financial education, this is like an umbrella covering different types of interventions. So what do? We have a theoretical model in which individuals have misperception biases regarding the expected returns of different assets. And more precisely, we will have individuals that do not have the right perception on the returns of a risky asset. This misperception can be heterogeneous, so we allow for optimism with respect to returns, or also pessimism with respect to returns. And what is key to our paper, it's also in our title, is that agents are naive, so they never realize that their perception is not correct, and so they basically do not value education. So it seems important to us to explore this case, because of course when you have misperception, you might actually not acknowledge this misperception, and then it's very difficult to provide education when the government wants to provide education, because people will only see the cost of education, but they will not anticipate the benefits. So our main question is, what is the optimal mix of financial education programs and pension plans? So basically we start with a model with misperception biases, and then we say, okay, what can compulsory contributions do? So what can the pension system do? And then if the pension system cannot correct for all the biases, can financial education help, and how and to what extent? And how should we design this education? So I will be very brief on the model, but just to give you a flavor, we don't need to read all the stuff, but basically we have individuals that live to a period that they can save, and they can choose between two assets: a riskless asset, which has a certain return, which is called RB. And then we have a risky asset, which has a certain return, which is higher than the one of the riskless asset, but only with a certain probability. So it is risky because with some probability, it yields a high return, but higher than the riskless asset, but with some probability, it yields no return at all. So when individuals maximize, the individual's true utility function is just given by, I will not go through the full equation, but it's just given by the first period consumption plus the discounted second period consumption, which is uncertain, because if they invest in the riskless asset with some probability, they will only get the returns on the riskless asset, because the risky asset has failed them. And so this is the true utility function, which is also the function that is maximized by the social planner, who is paternalistic in our case and maximizes utilities ex ante. However, people have a bias. So their perceived utility function is not exactly the true utility function, but is a function which is where the probability that the risky asset is going to give a high return is, let's say, misperceived. And the bias is given by this phi, which is basically which we model this way, which we model in this way, a parameter alpha. So if alpha is greater than 1, the agent is optimistic. It overweights the probability that the risky asset will yield a high return. And if alpha is smaller than 1, the agent is pessimistic. And what is important is that this bias can be corrected by education. So you see that here, if education is equal to 1, education is E. If education was equal to 1, the function phi would go to 1, and then there would be no bias at all. So with a very high level of education, all agents basically can correct for their bias. However, education is costly, both for individuals, in our model, both for individuals and for the government. So I will basically just, since we don't have so much time, I will just basically sketch the results. I'm not going to solve the model, this is all for the equations. So first of all, we show, not very surprisingly, that in the laissez-faire, pessimistic agents will invest too much in the riskless asset and too little in the risky asset in comparison to the first best optimum, to what the social planner would do, to what an unbiased agent would do. And the reverse is true for optimistic agents. Optimistic agents invest too much in the risky asset and too little in the riskless one. Then we introduce step by step our policies. The first policy is a public pension system. Here we take a pension system which is very simple, which is a mandatory contribution in the riskless asset. In a riskless asset, and we call this contribution B. So this is basically the pension contribution. And we can show that B, this contribution, will be equal to the optimal investment in the riskless asset, but will not correct for all the biases, because optimistic agents will still invest too much in the risky asset, while pessimistic agents will just top up the contribution. They want to invest even more than what the government makes them invest in the riskless asset, and so they will be able to do that. So in presence of if people can top up the pension contribution, well, the government with a mandatory contribution in the riskless asset cannot basically do much. Can correct a little bit for optimistic agents, but that's it. And actually, in an extension, we also show that this is true even if the contribution is in both the riskless and the risky assets. So the fact that individuals can top up can basically undo partially the public policy. And then we look at financial education in addition to the pension plan, and we assume that this education can be personalized. So the idea is that people might fill in a questionnaire, and this is the case, for instance, when you want to purchase certain types of assets. For instance, in France, you have to fill in a questionnaire that defines your profile and your knowledge profile and financial knowledge. And then maybe financial education could be conditioned on the answers to these questionnaires, on your beliefs about, for instance, the stock market returns and your ability to manipulate financial concepts. And so, as I mentioned, education is costly, so it's financed through a personality tax, and it entails a private cost. So individuals, they have to take this education, they have to devote time to it, and a public cost funded through a tax. So what we show is that because education is costly, you don't want to provide education for agents who are not too biased. You only want to provide education for agents that are either very optimistic or very pessimistic. And then for these individuals, the education increases with the size of the bias. And since there is a tax, the social planner will find it optimal to redistribute towards agents with a large misperception bias by making them contribute less in proportion with respect to less biased agents. So just to be more visual, financial education looks like in this graph. So we have so if alpha is more than 1, this means that the individuals are pessimistic. They don't think that risky asset is very good. And so if they are very pessimistic, you wouldn't want them to have a very high level of education. If you're just a little bit pessimistic, you just leave them alone. And the opposite is true for optimistic agents. And when it comes to then we turn to the case where there is asymmetric information, which means that the government cannot directly observe the biases of individuals. Individuals can only have to report to government their bias. So the idea is that the famous questionnaire on which you base the level of education might be manipulated by individuals. Under full information, we can show that, well, as I showed you before, individuals with a larger bias will get higher education, but also higher compensation because they are worse off. If you want ex ante, they are worse off. They are more biased, so they get a higher transfer. And this means that under asymmetric information, when beliefs about the riskiness of the risky asset may be over or under the reported, well, there is an incentive for individuals that are not very biased to report very high, large biases in order to get a higher compensation. So in any event, the result is based on the fact exactly that individuals are naive. So individuals do not value education. They do not anticipate any effect of education. So the only thing they care about is the transfer that they receive. And so individuals with a low bias will want to get more distribution towards them, and then they will basically over-report their bias. And so we can show, well, the result is pretty standard. Education will be distorted upward for agents with large misperception biases. So to reduce the incentive for agents that have a low bias to misreport, because in that case, they need to take more hours of education. And so basically with respect to the with respect to the full information case, education is now distorted up. You see education in the asymmetric information case is the dotted curve. So here education is distorted upwards for individuals with large biases at the extremes, and it might be distorted downwards or upwards for other individuals. So the intuition again is that since individuals do not acknowledge the bias, they do not value education, and then you distort upwards at the extremes in order to discourage mimicking. So to conclude, we show that pension systems alone cannot correct for heterogeneous biases, and this is particularly true for pessimistic agents, which are underinvesting in stocks, and this is basically in line with the puzzle, the stock market participation puzzle. And we show that financial education is welfare improving, but does not correct completely all the biases. Since individuals are naive, they do not anticipate the impact of education, so you have to induce them to get education, you have to compensate them, and then under asymmetric information, you will also have to distort education exactly because of this. So I am done.
Thank you so much, Dr. Canta. We still have some time for questions, comments, insights. And I also noticed that we still have 4 papers, co-authors in the room. So if you have questions about previous papers, also a good time to discuss. Yeah, I may kick off. My question to Dr. Canta is, do you know the bigger picture of how people look differently for people who have misperception compared to people without misperception, right? In addition to like educational differences, is there any other like demographic, social economic difference between those groups with and without misperception, or with different extent of misperception? So I wanted to know how to depict some characteristics of those individuals.
Yes, so I know, as you mentioned, I would know about education. I mean, in general, education is correlated with financial education, but yeah, and with other, there are some empirical papers. I should check them. I don't want to say something silly. I mean, for sure, education is the main explanatory variables, and there can be differences in terms of socioeconomic status. I mean, I think it's more or less what you would expect, and that might explain these biases. There has been also. I know that there are some papers looking at how macroeconomic shocks affect perception. So people that were exposed to a certain crisis, they might be the stock market crisis, they might be more cautious with respect to the stock market, with respect to individuals that were not. So this might also be. I'm very bad in remembering but I think it's there are a bunch of papers that look exactly at that. So this can be another reason, experiences, like individual experiences.
Yeah, thank you so much. I think it's very important and interesting paper. The reason I asked the previous question is I saw a recent increase, a growing number of studies on different kinds of misperception. Some are about like financial misperception, some are about health misperception, like having misperception about one's health status or disease. So,
yes,
and there potentially be different reasons, right? Some people may be lack of some knowledge, like financial knowledge, but some may be just overconfident about everything. And there's even a literature about healthy aging to encouraging people to have a more optimistic view about their health, although they are in bad health. So because there's some literature showing that being optimistic is actually doing good, like improve people's well-being and leading to longevity. So, but this is a different literature, but I saw people are all using misperception as the term. So you may be able to integrate your contribution to the bigger literature, like growing literature on this, right?
Yes, it's a great suggestion. Yeah, thank you very much. It's actually a very good point. I don't have much to answer, but
I just wanted to know whether they are the same group of people like who are misperceived about their health as well as their financial assets or something. Yeah, that would be fascinating to know.
Yes.
Yeah, any questions, comments before we end the session? Yeah, Klaus.
I have no question. I'm just showing back. I was watching you. Okay, I'm closing the session as
Good.
You close it.
Yeah, I believe all fascinating talks. Those 5 papers.
Thank you. Bye.
Thank you to all for coming to the presentation. Bye
Yeah.
bye.
Thank you
very much.
and everyone.
The session.
Yeah.
Okay,
I look forward to see everyone in person sometime. Yeah. Bye-bye.
Everybody.